If your mate snores, then you may be spending lots of nights in separate bedrooms. iVillage.com's medical reporter, Amy, can you believe I said that, Amy? Amy Hendel has some great information about how, why, and what to do about snoring. Amy, welcome.
Thank you so much.
How are you?
Good. So it is a serious subject. This is not just snoring bothers me. This is a social disease. You have marriages that break up. You have relationships that break up. Yes. But you also have a more serious condition called sleep apnea that is directly associated with snoring. So we need to know what's annoying and what's serious.
So tell us the differences and why we all snore.
First of all, I think you should know some statistics. 45% of men and 30% of women snore. So one wonders, how does that correlate with the divorce rate?
Yeah.
And I'm going to wonder about that for a while.
And you can move that up to like 70 people are dealing with a problem because the snorers need to meet each other.
Exactly, but at the base of the problem is restrictive breathing. So you can imagine in your nose, in your mouth, in your throat, there can be some reason for snoring. Anything that narrows an airway. So we're talking about allergies as a transient snoring problem, tonsillitis, swollen, deviated septum. But then it gets more serious when it gets down into the back of the throat, and that's where we start talking about possible sleep apnea. So the deal is, obviously we have to go do some studies. Sleep studies may show whether it's an annoying snoring problem or whether it's a more serious problem. Obesity is really associated with sleep apnea, and we're seeing it in kids and teens.
That's what I was just about to ask.
You know, I start to wonder, ADD, poor performance at school, sleepiness in the morning, you get poor quality sleep, and we even know that accidents happen on the roadways because of people who have sleep apnea who are not getting good quality sleep. But even more importantly, heart disease, diabetes, they all stem from chronic sleep apnea. So there are great treatments out there. We need to talk about those.
Yeah, and how do you know if you have apnea? Because that's different from snoring.
You would basically
there might be somebody watching that's saying, you know, I'm not sure if my husband has this.
Right. So you could have your spouse do a sleep diary where they're watching you, and if you stop sleeping, if you stop breathing while you're sleeping, what happens to a sleep apnea patient is they're snoring, suddenly they gasp and stop. Then the carbon dioxide and oxygens get all out of whack, and suddenly the brain says breathe, so they go and they start again, and they can stop 100 times during a night. So it's snoring plus stopping breathing that equals sleep apnea.
Okay, so what can we do?
So let's talk about what we can do. So let's go from most serious to least serious. This is a CPAP machine, continuous positive airway pressure. What it means is you put a mask on, and they have different size masks for little noses and big noses and kids and adults.
And I've heard about this, but I've never seen one. So this is a large apparatus, though. You're going to sleep in that.
You're going to sleep in this, but the sleep apnea patient who finally uses this suddenly wakes up the next day and says, I never knew that this is what sleep felt like.
I mean, this is pretty extreme.
It's pretty extreme, but so is sleep apnea. And you know what?
I just can't. You're looking over in bed. You're like, yeah, you know.
The kids love this because it looks space age, but this is not fitted to you. It would be fitted to you. This goes on, makes white noise.
I would end up with the largest one, right?
Well, I don't know about that, but basically the noise of the machine will not bother a spouse because they're so used to loud snoring. This is nothing. And so you're getting somebody whose spouse gets quality sleep and they get quality sleep. It's a brilliant piece of machinery.
That's right. Nema, you have a question.
I do. I have a question from East Village Girl, because there are a lot of myths about this. Does the position that you sleep in actually make a difference to how much you snore?
That's a great question. And the answer is, if you're a true sleep apnea snorer, you can put them on their side, you can put them on their stomach, they snore. The average person put a little tennis ball in their pajamas and sew it in. They'll sleep on their side. They probably may stop snoring, unless it's a bad cold or allergies or something like that. And we have other things for that kind of snoring.
But this is extreme, and people that wear these are very happy, actually.
They are very happy, and insurance pays for this. Your doctor writes a prescription after you've had a sleep study. You get this thing. They are happy campers, new lease on life. This is a mouthpiece. It can pull your tongue forward. It can move your jaw forward, so your fleshy tongue is not vibrating, or so your palate is not vibrating. Remember, some people have a really fleshy uvula. They've got a lot of flesh in the back of their throat. This can adjust it. So if you worn a bite plate as a kid, you can wear this.
Perfect.
And then there are the typical nasal strips.
Now, I said I snored when I was pregnant. I gained a lot of weight, and I snored, and those didn't do anything, my husband said.
This is a new little guy that I saw at an expo, and it has, I'm going to hold it so the camera can see it. It has two tiny little plastic cylinders. You would place it in your nose, so it actually holds the nostrils open. I don't know how much the breathing strips actually hold people's noses open, but the football players say they can certainly breathe more. And then there's moisturizers and steroid sprays. If you're snoring because you have a bad cold, because you have allergies, because you have asthma, those guys can moisten, make the airways a little more patent, so you're not vibrating, because it all boils down to vibration, whether it's more serious or annoying.
Thank you so